Welcome to the special edition, well, always a special edition of the Chiefs. With us right now are Ana Marie Pamintuan of the Philippine Star, Lucy Cruz Valdez, the head of News 5.
I was wondering when we would drop that word.
Always special because it's a special, no, it's a...
Sabi nga ni Dash sa The Incredibles, if everyone is special, no one is. So,
well, maybe when you get back to the studio, it's no longer special. and joining us in a little while will be Robbie Alampay of One News, reporting from the News 5 newsroom.
all right.
Oh, anyway, yeah, I guess let's begin with what we expect. What we expect to see on the Philippine Star, I suppose, tomorrow.
Hindi yung mag-house to house na daw yung mga state forces natin to look for the asymptomatic and mild.
And the mild.
And yeah. Titingnan muna yung bahay mo kung pwede kang mag-isolate. Kung hindi ka pwede, dadalhin ka sa quarantine. Yan ang how are they going to do it? No?
Yeah. How many people will you require to do that and to screen people who are possibly asymptomatic or possibly mild? Kasi the fact that they're mild or asymptomatic means that they don't exhibit anything. So not unless you test them on the spot and get the result on the spot, then you don't really know. So medyo masalimuot ding gawin.
Yes.
Paano ba gagawin? Paano nila malalaman kung sino yun? Dapat nagpa-test muna, ganon?
Baka at the outset...
positive, asymptomatic, ganon. Ganon ba yun?
Secretary Anyo was asking people who know of people in their community who are possibly asymptomatic or mildly positive to report them. Well, I suppose it's a word of mouth siguro or chismisa.
I think we can expect legal challenges in certain.
Hirap nun.
It's a bit difficult to implement.
Di ba?
Yeah.
Kahit ituro ka ng kapitbahay mo, I'm sure may protesta dyan.
Yeah.
Paano kung mainit ka sa mata ng barangay?
Exactly.
Right.
Exactly. Di ba may mga incidents early on in the early days of ECQ, maraming mga ganyan na complaints, di ba? I mean, not just yung innuendo, not just yung chismisan, but you even had, di ba, incidents where frontliners were being chased out of their neighborhood.
Yes.
Chased out of the barangay. So talagang, you can't put anything beneath human nature then sometimes.
By the way, that's Robbie Alampay over there, coming in from the TV5 newsroom.
Parang lahat tayo suspect, Parang may ganun kang feeling. Parang you can be a suspect, di ba? So, pumahin ka lang ng konti or pumahin ka na ng 2 beses o 3 beses. Makasabihin na ang kapitbahay mo, parang may positive dyan.
Yung mga ganung bagay, kailangan pang plansyahin yan. Yung protocol in determining who is a suspect, whose house you have to enter. Kasi you're talking about security forces going into your house. So may protocols na kailangan establish yan on who can come in and on what authority and by what qualification. And then secondly, kasi they have to judge the house itself. I mean, is this house qualified as a quarantine area? Ibig sabihin, sapat ba tong lugar na to in terms of space para hindi maghawaan? So they have to come up with protocols for that too.
And I think papasok talaga yun. I've already seen some posts and some commentary, and I think papasok talaga yun. The differences in how this will be applied with middle to upper income households, and then of course yung nasa urban poor. Now of course you sort of can anticipate what government is saying na sa urban poor areas talagang siksikan, talaga namang madaling magkahawaan if you're all living in a confined space. But that's going to be the reality. There will be for lack of a better term, discrimination on and differences on how people and it will be very superficial. They will look at your house, they will see, maraming lugar dito, may sariling banyo yan, pwede sila maghiwa-hiwalay. So this is really a policy that you can see really being focused on the lower income families more than anyone.
Kasi requirement daw yung isolation room mo, kailangan you have your own bathroom.
Yeah.
Yun
Yeah.
ang
Oh, dapat en-suite. Wow,
Yes.
social.
Kaya, well, anyway,
Grabe,
siguro
So
pwede.
those are elements that have to be clear before they start implementing that. Kasi they're talking about house to house. So medyo masalimuot nga yun.
Yeah.
Baka magkaroon pa yan ng baka magkaroon pa yan ng gulo na baka maging violento yung ibang tao, no?
Actually, yes.
Although in principle it does make sense na yung mga mild tsaka yung mga asymptomatic should not be allowed to stay in a domicile kung saan sobrang liit at
Oo,
magkabaan lang.
sabi ng official,
It does.
5 square meters lang daw.
But it's going to be a highly emotionally charged exercise. I can imagine, di ba? Kunyari, anak mo yung kukunin. Oh my, parang, di ba? Tapos ihiwalay sa'yo. Di ba last week lang when we were discussing sa hospital, how do you force a patient to move from the hospital to the facility? Di ba? What if you say, wait, nagbabayad ako eh. Gusto ko dito, di ba? Pero ngayon, pagpwersahin ka na. Yeah. So,
Ayan, pwede natin itanong sa guest sana natin, kaya lang wala pa yan.
Yeah. But
But of course, yung
may
kabilang side naman ito, if you look at it from the top, looking down, another rationale they have, of course, is they also want to decongest yung mga critical healthcare facilities that, as we know, the other big story here, the other aspect of this big story is the fact that hospitals are already saying they are in the danger zone already. They reached the 70% capacity for specifically to COVID. And one rationale that government is really why they're really pushing people into isolation centers is really to lessen the burden as well for the critical care facilities.
yes, that's right. Okay.
Subukan na natin yung guest natin. Nandiyan na yata.
She's here, diba?
Yeah.
Okay, at least our first guest for tonight is the Executive Director of the National Kidney and Transplant Institute, Dr. Rose Liquete. Doc, are you there?
Ay, umalis ulit.
Si Ami, fake news ka naman eh.
At the big hospital, at pati sila nagsasabi, wala na yung nila, yung, ayan na pala.
Ayan, si Dr. Hi, Doc Rose.
Mukhang
Good evening po.
Si Doc.
Good
Yeah.
evening. Yes.
Doc, thank you for joining us po. Wala pang audio. Doc, can you hear us?
Now,
Ayan.
sorry, I had a call.
There you go.
Ayun. Hi, Doc. Thank you for joining us ito sa The CHIEFS. You're with Lucy, Ami, and Robbie, and ako po si Ed. Doc, we understand that the NKTI is already in the danger zone as far as yung COVID-19 capacity is concerned. Pero yung NKTI po naman is not a COVID designated hospital, di ba? So you're looking at 30% mandatory pa lang naman na nasa danger zone po kayo. Tama ho ba?
Yes, we allocated more than 30% of our beds for supposedly suspects, probable COVID. We are forced by circumstances then because initially we said we will not accept COVID because we are a transplant center.
Yes.
And we have compromised patients. But then you cannot avoid having these patients who are mostly renal also and mostly on dialysis. So we tried to refer to other centers but napupuno rin sila. So we have COVID patients now because of the difficulty on referring them to other hospitals. But our referral centers are the Jose Rodriguez Lung Center and PGH. They help us naman, but they're also full, no? Just like our hospitals.
Pero Doc, qualify po. When you say danger zone, what numbers are you looking at?
Well, ang definition nila of the danger is if you're occupied more than 70% of your allotted beds supposedly for COVID. And we have We have, initially, we had 94 beds. And then if you're going to count the emergency room, no, as of yesterday until this morning, 100% na kami. More than that. Yes.
So, ma'am, if that includes the emergency room as well, then kamusta po yung non-COVID cases nyo? I mean, maraming mga tao gumagamit ng tumatakbuhan ng NKI. Kamusta po yung non-COVID traffic of patients no?
Yes, we have non-COVID wards naman, and they're mostly in the other wing. So we cannot touch that because we have also we have to take care also of other non-COVID patients. We had some transplant patients there, or transplanted months ago maybe, and some other cases which are not really renal.
Pero isolated po yun. I mean, it's not affected by the situation on the capacity, the capacity limits sa COVID.
Well, in a way, it has an effect on our other non-COVID patients because, for example, our transplant patients, they would be afraid to come to the hospital to consult or even to have their laboratory tests. It's really hard. It has really affected all other non-COVID cases. Nag-decrease din ang admissions namin sa kanila.
Ma'am, kung dati po nakakailan kayo na transplant in a day or in a week, kumusta po kayo ngayon? How many transplants are you able to perform?
Okay, in the past 2 years, more than 500 na transplant namin. Ngayon, from January to the first quarter, naka 100 na kami. Now, as we resumed nitong June, July, wala pa. Wala pang half. So, which means talagang maka-cut off ng todo-todo ito.
So, are we assuming na maraming are we assuming na maraming mga renal patients ngayon ang in danger, no? Or at risk even of, I mean, may pagka-morbid, no?
Are they essentially foregoing and we all know how hard it is to get a donor and a transplant, but are they foregoing that possibility, suspending it for a while?
It's possible. I have a patient nga ready na sila before the GCQ, the ECQ, but then some of them lost their donors. They don't want anymore and are afraid also to come to the hospital. So there are several reasons na hindi na rin natutuloy yung iba. So we had a list actually of patients who have been approved already by ethics committee. Hanggang ngayon hindi pa rin sila dito. So we have a target like three transplants a week. Hindi rin namin napupuno yun. Dati, sometimes you have 3 in a day. No?
Doc, are the fears justified? Because I have been operated on in the National Kidney, no, not for a transplant, but I've been operated on, and your surgery facilities are one of the best I've seen, no? Is it justified for renal end case patients to be fearful and risk not getting a transplant? Is it justified?
Well, we have a consent for this patient and a waiver, of course, that they know that we are harboring COVID patients here. We take the precautions naman. Like, for example, every patient before any surgery, we also take the swab test. And also the watcher. We have a swab test and an x-ray of the watcher. So we can say that all the transplants you are in this ward, just the whole ward is dedicated for them. No other cases except transplant. So that's our assurance to them. Before, we can have the transplant patients mixed with other non-infectious patients, of course. But now they have it for themselves. But now we only have like two transplants in that in that area when it's supposed to occupy like 26 beds.
Oh, wow.
We
Yeah.
have five five transplant
Wow.
recipient and
Yeah.
donor there. So that's
Yes.
Doktor,
Yeah.
sabi ng ibang officials in charge of the COVID response, kaya daw nagkakaganyan, napupuno, kasi pati yung mild and asymptomatic, nagpapakonfine sa mga hospitals. Is it the same case sa NKTI? Saka, have you raised the issue with the government? Anong sinagot nila? Kasi yun ang sinasabi nila eh.
Yes. Ang mild, hindi namin talaga dapat i-admit, no? But we have healthcare workers na mild ang symptom, but they cannot isolate themselves in their family, in their home. Typically, we have big families, right?
Yes.
Nandun si kuya, si lolo, si lola. Kaya, they're afraid to go home. So, okay, at the outset, we try to accommodate them because parang isang ward doon na parang infirmary na rin sana dedicated to our health workers. Pero napupuno din. So, we advise them to go to facilities, yung mga temporary
Yes.
facilities.
Ayaw.
They say, hindi naman
Ayaw
mo
nila.
facilities,
Yeah.
ayaw.
Wow.
Pero kung ang DOH ang magsabi, you have to move to an isolation facility. How complicated is that? In your case, health worker pala yung marami dyan.
Mahirap. I am also DOH. We are DOH. Mahirap din mag-convince, and they will say, it's more difficult to manage your employees. They will
Oh,
say,
yeah.
Yes.
yun naman
Pero Doc,
kami.
that's for health workers eh. I suppose we can understand po for health workers eh, special case dapat yan. Pero for patients coming from outside, yung mga
Yeah, regular
patients
patients.
na
Refer them
are symptomatic or
to the barangay.
mild.
We refer them to the barangay. At sila nang bahala doon. We have reports naman eh. And then they will do the contact tracing sa epidemiology ng barangay or so.
Yeah, pero marami ba kayo nung regular patients na mild lang naman pero hindi nyo mapaalis, hindi nyo mapatransfer? Marami ba kayong ganun, Doc?
Hindi mahirap, hindi masyadong mahirap if hindi namin sila.
Oh, I see. I see. So that's less of a problem. Okay.
Yes, basta hindi namin patient.
Yeah.
It's
Doc, beyond NKTI, for people with kidney and renal issues in general, would you know the situation? I mean, outside, basically for this sector with renal issues, mga kailangan mag-dialysis. What's the situation in all other centers beyond NKI? Do you monitor that? Do you have any idea?
Sorry, it's a bit choppy. Do I have the...
Yung beyond sa labas po ng NKI, are you monitoring? Do you have a sense of the situation for dialysis centers, for example, and I mean this entire area that services a very crucial segment of our population?
Yes, that's very important for these patients who are on dialysis. Sometimes they miss 1 or 2 dialysis and they come in like with pneumonia. You suspect them to have COVID already, We have lots of patients like that. They came from outside. Now, before it took a long time for the turnaround time for the swab test to come out. So we're treating them, etc. And then to know in the end when the swabs come in, ay positive pala ito. Now, if you're able to treat them or they can go home, they cannot be accepted by the dialysis centers. We had a patient on dialysis who is positive, and then sometimes the nurses will resign na or they close up on the dialysis center. So that complicates the matter because they add up to our dialysis patients, yung regular namin.
Yeah.
That's
Oh.
actually the scenario now. Some centers have closed.
So,
Do you have an idea of
yung dialysis machines ninyo, are they overutilized also now?
Yes, initially we only had like 62 machines, no? And that's 24/7 already because we have lots of patients on dialysis, original dialysis. Now we
Wow.
added, we have now 68. Initially
Okay.
we had 16 and then it was pulled out already by the company. Now we have 68 machines now and it's working 24/7. You know, it's like
Wow.
four patients in
Wow.
for patients
Yes.
that it's like 4 hours per shift and
Yeah,
then
right.
the contamination and then another
Yes.
patient.
Yes.
So
Yes.
24/7.
So,
Ma'am,
so
sundutin ko lang yung sinabi
technically,
nyo about, sundutin ko lang po mabilis yung sinabi nyo that some dialysis centers have actually been forced to close. Is that just anecdotal or do you have data? Do we have any idea of ilan po ang naapektuhan na dialysis centers?
Well, I don't have the exact data, but I requested the DOH in charge of these dialysis centers to really they have to make survey of all the dialysis centers. But I know personally dialysis centers because friends ko rin naman mga nandoon.
Right.
We close down na ganito. Nag-resign yung nurses namin ganito.
Wow.
Well, for a fact, for my friends in the
Right.
dialysis centers that I know here in Metro Manila. But it's true because some patients would come, ayaw ho kaming aksipin. Okay.
Yeah. Now, Doc, I know how it is to be in dialysis. No, I've experienced it. Just so our viewers can have an idea of the magnitude of difficulty you must be facing. Can you describe to us, for example, how many patients can be accommodated by one machine in a day? Because you're saying you're now 24/7, right? So, ilan lang ang kaya? Kasi one patient, 4 hours, right? 4 hours,
Yeah.
tapos may cleanup, meron pang cleanup period between, no? So tatlong patients lang sa isa, right?
Well, sana mga ganun lang tatlo, but you're forced to have 4 also. Like these suspects namin or probable and positive, we have to put them on the last shift, para hindi sila maghalo sa iba nating pasyente. So, yun ang idea. But some centers actually, yun ang common, 2 to 3 shifts lamang because you need also nurses eh. Kulang din ang
Yes.
nurses. That's why they close also or they limit the number of shifts because kulang and the contamination. So if you imagine now, like 68 machines kami, times 4 mo na lamang a day,
Yes.
no?
Right.
And patients dialyze 3 times a week.
Yes, right.
Doctor,
So, that's
ilang health
So-
workers na ng hospital ang affected ng COVID? Hindi ba nagka-problema kayo at the start eh? Sa ngayon, yung nurses nyo and doctors, mga ilan ang na-affected?
Well, ang na-affect na sa amin is 145
Wow!
patients.
Oh, wow.
Yes.
Okay.
But in the last in the last 2 weeks na ito, we were also worried because mukhang mabilis yata. I get the result of the swab every day, no? So I get
Overnight na.
Yes.
sabi ko, bakit ganon? 3 to 5 or 4 average of 4 health worker every day in the past 2 weeks.
Nadadagdagan.
Nadadagdagan ng positive na health worker. Of course, most of them mild naman, no, mild. But of course, you worry about them because they have they eat together with other nurses, they go home to their families, and if they test the families, nako, mga anak din pala positive, no? Talagang family affair na yung COVID na yan.
Right.
So, increase na yon, hindi pa man nakakabalik yung 2 weeks na yan, quarantine ka kunyari. Hindi pa nakakabalik, nadadagdagan na naman ang mako-quarantine. So, that's
So
why...
So
Ah,
undermanned kayo ngayon? Undermanned? Wala kayong
Yes.
makuhang pamalit? Ganon?
undermanned kami. At any one time ngayon, may 48 kaming walang healthcare worker.
Oh,
And
dear.
we have augmentation by the DOH. Sabi, okay, we allow you to get 41 nurses to augment the, wala namang nag-a-apply. Actually, 2 months na yung sinabi sa amin na 41 idagdag namin. Ngayon, mga 30 pa lang ang nag-apply sa amin because they're also afraid, no, that they will be assigned in the COVID. So, and of course, alam mo naman ang mga nurses, they really after the green back, di ba?
Yeah.
Right. Yeah. Mas gusto nila sa abroad. Oo nga. So,
Yes,
I'm surprised na nakakakuha pa kayo. And you're just one hospital out of many now whose health workers are also dwindling in number, di ba?
Actually, we got a nurse from another center. Kasi daw nasayang siya sa COVID. Okay, sabi ko, sige, augmentation din sa amin. I will assign you in the operating room because some of the nurses in the operating room were also assigned in the COVID. So, ganun lang.
Oh, yeah.
Augmenting kami.
Ang hirap. Grabe. Wow. No. Bow kami sa inyo. This is such a challenge. Yeah.
Yes. And
Okay.
And also
Si-
sa medtech din namin. Di ba? Sila ang
Yun din.
nagpa-process ng mga swab
Right.
test. They
Right.
swab and process in the labs. When they're in the laboratory, full PPE sila talaga, level 4. Contamination yun eh. We also have medtechs na nagpa-positive. So,
Grabe. Yeah.
multiply yan. So, ayan, we should do this and that. So, we have to contain the virus and we have to stop admitting. That was 2 nights ago. Stop kami. And now, I am trying to transfer some of the patients to our other colleagues. And hopefully, if we can sort of clear up first our ER so we can fully decontaminate. When we had our tents, remember, I think you know that we had tents before.
Yes.
We had to decontaminate only if the the tent is empty or on the sides only. But right now, hindi namin dahil ang ER is very much loaded, fully loaded. Hindi ka makadecontaminate. Misting and all. May patient.
Oh, wow. Nakakatakot.
Grabe, no? Tali-tali yung mga problema.
Doc, if I may, I'd like to pursue lang a question earlier asked by Lucy and push it a bit further down. Kasi po, syempre, your hospital specializes in kidneys and you do a lot of dialysis, and that entails a lot of handling of bodily fluids. For example, when you do dialysis, yung buong dugo ng tao talagang paiikutin nyo. So you're handling a lot of fluids. You're handling a lot of fluids from the body. So because of your specialization of your hospital, is there a bigger risk of, would you say, contamination or infection by COVID-19 because of the specialization of your hospital?
Yes, our nurses in the dialysis center, they have to be in full PPE also. Yes,
Yes.
full PPE. Protection din nila yun eh. Okay?
Right.
And also protection to the next patient also. That they
Yes.
are gonna have. You don't own that machine na kung madadialysis ka, that's your machine right away, no? Hindi eh. Maybe the next time around sa ibang machine ka na naman.
Yes,
So,
yes.
kailangan ma-protect natin lahat sila. So, before, it used to be like hepatitis lang, sineseparate natin, no? And now, ito na si COVID. And mas grabe pa ang kanyang, yung kanyang sakit na yan.
Infectiousness.
Yeah.
So, naka-full PPE din ang ating mga nurses during dialysis, especially when they handle these suspects. These suspects, sometimes we do na the swab. Okay, negative siya. So, inakyat na natin sa hot zone din naman, sa hot zone because that's the whole 4 wards itong hot zone namin. But then they come out later on, we test again, because why is the pneumonia not resolving? Turns out to be positive. Oh, nako. So, ito na. Kaya naipon ngayon sila sa hospital.
Yeah.
Right now, we have 51. But they're in the hot zone. And everybody's in the
Yeah.
bunny suit.
Yeah.
The bunny suit.
That's a better term. Bunny suit. Okay.
Okay. Dr. Rose Liquete, Director po ng National Kidney and Transplant Institute. Maraming salamat po for joining us and maraming salamat po for what you're doing. And please relay our gratitude to all your staff.
Yes.
Salamat.
Thank you very much.
Prayers for you.
So you are all chiefs. Oh, thank you very much.
The chief of the NCBI.
And you're the chief also.
Hindi ho sa bahay, hindi.
Sa bahay chiefs din.
Salamat po, Doc.
Salamat
Thank
po.
you. Good
Thank you.
night.
We will just go into a break, so please stay with us.
At si
Idong
Robbie ang
Philippine ngayon,
pinagtatanong ko. Hindi si Mahar. Ay, grabe.
mahina ang mahina business ngayon. Wala na
Oh, exactly yon. He was stressed about the business. He was
Oh,
stressed
yeah,
about the
I know.
business.
Yeah.
Ah,
Yeah.
ang dati, isang question lang sa kanila, 500,000. Laki na nung nawala. Ngayon, wala daw ngayon, magkakaroon ng presidential,
Wala nang break ito.
Sabi niya,
Survey, wala, ano?
sabi niya, hindi, pwede naman. Gusto niya mag-survey? Bayaran mo. Bayaran mo.
Come on! Sinabi ba niya yun?
Hindi, sinabi niya,
Sabi niya,
I'm not saying give us money.
One data, you have to sponsor
You
it.
pay for it. I'm not saying to me, but you pay for it. Kilala niyo naman yung sino, kilala niyo naman kung sino mga pwedeng magbayad.
Parang kulang na lang sabihin niya, yun.
Ano, no? Kulang na lang,
Yun. Sinabi mo diretso yun, yung hingi sa amin. Kasi parang kulang na lang.
No, we can't keep doing this for fun.
Yeah. Parang kulang na lang sabihin niya na puro kayo palibre.
Buti pa si Dinda, nagbabayad.
Welcome back to the Chiefs. We're now in the final stage of a conversation, and we're waiting for our next guest. But in the meantime, we discussed with the head of the NKTI, the National Kidney Transplant Institute, the problems now being confronted by the hospitals.
Yeah.
No,
No, and
No.
when we talk about that, we started that segment with Dr. Liquete, the executive director of NKTI. We were prepared to talk about COVID, pero she really gave us an idea of the dominoes of problems na
Yes.
tali-tali. We went into a very big problem for people with renal problems, people who need dialysis. It's
Yeah.
not just about NKI. She's reporting that dialysis centers, like a lot of businesses, like a lot
Yeah.
of private schools and so on, that same phenomenon is affecting dialysis centers. Maraming nagsasara dialysis centers. There's a manpower shortage, nurses, medtech not taking on the jobs. Ay, grabe, sunod-sunod yung mga problema na na-discuss ni Dr. Liquete.
Yeah.
But I
And
think this is also happening in
give-
the private
Yeah.
hospitals, no?
right.
Yung Private Hospitals Association of the Philippines nagsalita din ngayon na yun na nga nagkakaproblema na rin ang marami sa kanila dahil nga nauubusan pati yung mga mild and asymptomatic cases, they have to take them in, saka mahirap, they're encountering the same problems, nahihirapan sila, nasabihan naman yung mga to turn away patients na ayaw naman pumunta sa quarantine, they want to go to a regular hospital. Yan ang problema.
Actually
But I meant to
namamangha
ask
ako
them,
kasi ako naman namamangha kasi weren't we just tackling this very same topic a week ago, no?
Yes.
And yet si Yusek Berhere was kind of assuring us that we were not near the 30%.
The danger zone, yeah.
Yeah, the danger zone. I remember that distinctly eh. Tapos parang sinasabi niya, tsaka ang dami pang mga quarantine facilities, ano yan, kaya yan, etc. Parang it reassured me somehow na wala pa naman tayo dun sa malapit sa danger, no? Yung pala, biglang, eto na nga, kinonfirm na ng St. Luke's, BGC, and Quezon City, Makati Med, and KTI, di ba? Sunod-sunod na. So it's really alarming.
baka kasi you'll have to shift, you'll have to shift yung mga mild and asymptomatic to the isolation centers for you to
Yeah.
decongest eh. And if you do that, mag-free up talaga yung wards. For example, if I remember correctly, parang sabi dito kanina, mga 90 plus yung kanilang COVID wards, tapos ilan sa mga pasyente nila yung healthcare workers nila, mga 60 ba? Or
Yes.
100.
Yeah, but Ed,
More than
but remember, the people who will then be moved and encouraged to move to the isolation centers will be coming from two directions. It will be coming from hospitals trying to
Right.
decongest, and now an active program by
Yes.
government to get people from their homes and the
Exactly.
communities into those isolation centers. Diba? It will be very interesting to see in the coming days what the capacity of those isolation centers really are once you have those movements, as I said, coming from two directions, from above, from the hospitals and the quarantine and the COVID centers, and then from the communities as they're essentially brought there by officials.
And
Alam
another
mo-
question, do hospital administrators have the authority to refuse admission to mild or asymptomatic patients and refer them to the isolation centers?
I think
The other one is whether they can. The
Meron
other one
yan.
is whether they're authorized to move them if at all by force.
May rule na you cannot reject a patient, di ba? Kaya yan ang problema din nila. Once you accept the patient, paano mo ililipat yun?
No, but I
Okay,
don't
pero-
think they're framing it as rejecting. I think they're framing it as triage.
Naman.
So they have every mandate, I think, they will accept you, but then they will make a decision on dito ka ba or ililipat sa isolation center. So it's triage. It's not rejection.
Pero yan
Yes,
ang sinabi ng di ba, ng St. Luke's and Makati Med, we can no
Yes.
longer accept dahil
Wala na talaga.
full na sila.
Yes.
100% full. At saka they also have patients na may ibang sakit kaya hindi nila pwedeng dagdagan. Kasi binabalak ng gobyerno, iakyat sa
iakyat sa fee, di ba? Yeah.
Yeah. And I will also contradict what I just said, because last week naman pinag-uusapan din natin, it is a real headache for hospitals na they're trying to move them, some people out of the hospitals already. And yes, we did get that impression that some patients were basically saying, no, I don't want to move. Diba? So apparently, it does raise the question that it raises na hanggang saan ba yung authority ng hospitals to decide for you kung dito ka or ililipat ka.
Against patient rights.
Yeah,
Diba?
can you be forced by the hospital na mag-alsabalutan? Yun magiging controversial yun.
Actually, ang gusto ko malaman, kung doon sa St. Luke's sa Makati Med, yun bang pag sinabi nilang full, lahat ba yun symptomatic or merong mga asymptomatic doon or even mild, di ba? Yun yung tanong eh. So you wonder nga, baka naman pwedeng bawasan ng konti to accommodate the more serious symptomatic ones. Yun.
But these kasi are private hospitals eh. These are private hospitals na medyo high-end na konti. So you can imagine na kahit asymptomatic or mild, they might be insisting to be confined. Paying patients eh.
Yeah, and whatever it is, whichever category.
Sabi ng kanina, it's manageable. So,
at saka hindi lang yun.
I will manage it in the coming day.
Lalo na if you can pay for a suite. Why would you be turned away? Kaya ako magbayad sa suite. O, kahit na asymptomatic ako, di ba sabihin ko, hindi, gusto ko sa suite. O, di ba?
Gusto ko yung sa household eh.
Now, consider this. Ang pinag-uusapan pa lang natin is on the demand side of the medical service. But as Dr. Liquete pointed out, they have a problem on the supply side as well, particularly on the manpower. May shortage ng nurses, nagkakaroon ng shortage ng ano. In fact, essentially, she didn't say it, but essentially, may turnover din ng mga hospitals. Some nurses, even if they stay in the health sector here, are transferring hospitals if they can leverage to a non-COVID ward.
Right.
Kaya siyempre, natatakot din sila mag-infect ng mga kamag-anak eh. Di ba? Lalo mga health workers, hindi naman yan nakatira sa mga mansion. Siyempre, medyo maliit din yung ano. Mahalawa ko yung mother mo, your children. Di ba?
And then the entire ecosystem. Diba? The entire ecosystem, again, just taking the example of NKTI, mga kidney operations, transplants, you would think people have been waiting for this literally for years, and they're having to forego it. They're having to suspend it. I think I got the impression the hesitation to go to the hospitals to carry through with even scheduled transplants is on both sides, donors and potential recipients. The donors are basically backing out of scheduled donations of their kidneys. Pagkatapos, I don't know. I think even donees are taking that risk of further postponing.
Eh di lalo na yung dialysis nga sa akin. Yung transplant. Kasi yung dialysis, kung hindi ka lang ma-dialyze for one day, ay grabe ng distraction nun sa system mo, no? So pag hindi ka you can't skip it. Pag sinabi na you have to
3 times a week.
3 times a week. You have to follow it. Otherwise, talagang it wreaks havoc on your system. It does. It poisons your blood.
It's toxin eh.
Yeah.
Because the kidney basically filters your blood.
Yes, it does.
I'm surprised na they have 500 donors in 2 years. Ganun pala kataas ang organ donation sa atin.
Actually, mababa yun. But it seems high.
Every year. Yeah.
I mean, it seems high, but if you take that to the demand for all of that, I mean, nakita nyo nga, yung sa dialysis, essentially, these are people that hopefully, but that they don't have the option for kidney transplants. And therefore, dialysis. And what did she say? It's essentially less than about 300 a day that they have to service, di ba?
Yes.
They're already operating at full capacity at what? Less than 40 machines that can only accommodate. Ideally, she said two per machine. They're already pushing those machines to 3 or 4 per machine on a
Yes,
24/7 basis. And when she says final schedule, it's literally midnight na yun, past midnight. Di ba? For a 4-hour session.
Mahirap pating mahawa ngayon, ano? Baka pag makita ka ng kapitbahay mo, ituro ka, pasukin ka sa bahay ng mag-house to house na. Paano yan? Tapos mamaya sisihin ka, ilalockdown yung buong kalye nyo dahil ikaw meron kang nakapanghawa ka.
Yun nga kasi the primary network would probably be the barangay that they'll be tapping into it. Si Sir Dindo is here.
Yeah, I'm using my mobile now.
Oh my goodness!
Sir, naku.
Sorry about that.
Grabe to.
Kahit late man na.
Okay, diretso na
We'd like to welcome political analyst Victor Andres Dindo Manhit, the managing director of Stratbase Group and president of the ADR Institute for Strategic and International Studies. Good evening po, very belated,
Yes.
Professor Manhit.
Good evening to everyone.
Thank you, sir, for joining us.
Isa na natin. Kasi tatanungin namin, yung kinomission yung survey, social weather stations, it showed na 61%, that's pretty high, no? Na believe the accusations of countries that China did not immediately share information on COVID-19 with the world. Maybe you can tell us more about it?
Yes, it's what we really wanted was simply to understand the perception of the Filipino people with regards to this issue with China. It's affecting us from, of course, we know it's a health pandemic challenges for all of us, but we know that we need to look at the root of it, which is we believe it's a virus from Wuhan that our own government tried to downplay. They even downplay the first two, you'd say, recipient or the one that got sick with
First
Wuhan.
two
These are actually tourists from Wuhan who flew to Cebu as early as January. So we just felt like it's good to understand how the Filipino feel, and also to be one with the world in terms of, should we make China accountable? And that is quite higher than the first question. It hits nearly 8 out of 10 Filipinos.
77, yeah.
So nearly 8 out of 10 Filipinos, yeah. So it just shows that because there was an attempt even by our own government to project that China was our friend. Remember, they even flew in some Chinese doctors.
Yeah.
Everybody needs to be quarantined, but this guy simply arrived in the airport and was ready to work there with government. And we felt, why the special treatment again? Why projecting this special relationship when the root cause of our problems is really China? So we just wanted to know if the public view it like us in our institute. And so we commissioned it through an independent institution, not us. So it will be biased. So we asked the social weather station in their first week of July survey to look into these things.
Okay.
Now,
How are you going? Dindo, how do you intend to use the data to sabihin na lang natin, no, I think your target audience here, priority audience, is no less than Malacanang. How do you intend to use this data, for example, to influence policy decision there when we all know where they stand on this?
It's I've always believed, and our own institute believed that we have been a champion of democratic governance. Government exists for the people, and this government, especially this government, their source of authority and power is actually the support that they had from the people.
Okay.
So we believe this kind of study, you just hope that it becomes an education, it becomes a guide.
Yes, but Dindo, Yeah,
Yeah.
and let me just ask. I mean, only because parang we know we started late. I want to get in as many as possible. But very quickly, just to summarize, I mean, today lumabas yung survey nyo that people wanted to assert that our government should fight for our sovereignty, should push the
Yes.
arbitral ruling, use it to our advantage. Malacanang said no. Beijing remains a very important friend. We will double down on our ties with Beijing. And then in Washington, Washington comes out with a position paper, very strong position, basically saying that the U.S. will stand by Southeast Asian nations in asserting their Where does that put Malacanang right now, or did we already hear it? Do you think that's the end of what Malacanang is going to say about this?
Uh, I think they were not expecting the strong statement on on a different issue that after 4 years of our arbitral victory, here comes the U.S. coming out with a stronger statement than they have had for the past 4 years. And we all know that Malacanang for the past 4 years have argued that not only the U.S. but the Philippines seems to be orphaned on this issue, which is not true. No, at the time that we filed this case, we have never been orphaned until we won the victory. It's actually our own government that has orphaned us in this case. And it took some of our neighbors to stand up on it, Vietnam, this year, Indonesia. Yeah. Then, and you'll be surprised that groups like Japan and Korea are making stronger stands also. So this is beyond really U.S.-China issue. This has become a regional issue on the need for a rule-based international system. The only problem is, will our government listen to this? Our own
but precisely that's precisely my question. I mean, people are reading into the Washington statement what Mike Pompeo said as something to put pressure on China, but does it in fact have the ultimate effect of building more pressure on the Philippine government?
You hope it does, and our own Department of Foreign Affairs Secretary issued a surprise strong statement last Sunday. And he got rebuked also by the Chinese embassy. But it just shows how undiplomatic also the embassy is to rebuke your own foreign affairs secretary. But then you get your own spokesperson of the government as if it's just a non-issue. I mean, so it's quite sad. But imagine 4 years after our arbitral victory, 7 out of 10 Filipinos continue to believe that we need to assert our rights. 4 years. So it's in the consciousness. And this is abroad. This is not referring to the intellectual crowd. The survey is broken down into geographical, it's nationwide. It's broken down into socio-demographics. Majority are D&E that represented the respondents. But one thing that we wanted to emphasize also, it's something that for the first time we asked, is maybe it's time for the Philippines to look at strategic alliances, because we really wanted this to be part of our international conference this morning. Strategic partners. Because we don't like to be brought into this narrative of China that those who are against China are simply tools of the US. No, this is not. This is a regional issue, and this will continue to be a regional issue to the point that exactly on this day, even the United Kingdom has mentioned or shared that part of their engagement in Southeast Asia is to position one of their US aircraft carrier. So you see some actions by countries that believe that there are aggression by a certain neighbor of ours, and we are in the middle of it. But it's good that's why we felt maybe it's good to ask again the Filipino public, because government, we believe, should represent the Filipino public.
Okay. Dindo, former Foreign Secretary Del Rosario is asking that the matter of the arbitral tribunal win and the position of the Philippines be brought up in the United Nations General Assembly on September. Is that something you're going to be aggressively pursuing?
We want to bring that idea from our chairperson, Secretary Rosario, because you need to internationalize the issue, because there is an international constituency to this. You cannot just keep on saying, because the narrative of our government has always been, we're a small country. What can we do?
Right. Do you think
So-
you will actually gain support internationally there in the United Nations? What
Yes,
kind of
because
response do you expect from the UN there?
no, it needs to be government. Government needs to be the one to do that.
Yes.
And in our case, so it's really more of giving options to our government. We're
Yes.
not fighting the government. We're telling them that there is another option. And if the Filipino people would like us to assert our rights, if the Filipino people, in this case 8 out of 10, would like us to work with other nations with shared values of respect to international law, the United Nations General Assembly is an opportunity to raise it. Indonesia just raised this issue a few months back.
Pero sir, even if we internationalize, sige, go ahead.
You
Go ahead.
think it will have any impact, because there have been several surveys showing strong Filipino support, no, for these types of actions, and for the government needing to assert our rights in the West Philippine Sea. But you think this latest one will have any impact on
I'm
policy?
not sure. To be honest, you would feel that there might not be an impact on our government, but I believe that you don't give up on an important issue on the Filipino people. We are spending time and resources in our institute to put this out there. When I remember, and I said it during my remarks earlier in our conference, when this came out, the decision, July 12 afternoon, days after, there seems to be no response from government. We were the only one, also our own institute, who hosted a discussion on this. And we will keep this alive. If this government will not listen, we hope that the candidates, when they file their candidacy next year, which is exactly a year and maybe a quarter, would believe that, look, if we politicize this issue, and I believe I know a little about that, turning issues into politics. So maybe that's my
That's your
role as a good.
specialty.
Maybe that's my role as a good citizen. Make it an election issue, especially when people will say foreign policy has never been an issue. But the difference here, this is not foreign policy. It's actually your own land
Yes.
or your own island, your own territory is being stolen. This is beyond
Yes.
foreign policy. So
Yes.
this could
Sir,
make
you
it an
emphasize-
election issue.
Yes, sir. You emphasize the need to internationalize the issue, but going by the past 4 years, the administration doesn't really seem to care about international opinion, at least on the surface. Now you've also spoken about the need to make this an issue for 2022. But by that, are we giving up on something happening within the last 2 years to change the way the administration is handling the issue?
I am not giving up. That's why we were quite happy with the statement of Secretary of Foreign Affairs. We hope this becomes the consistent policy of government. Then you get to hear the
Yeah.
spokesperson. So you get
Yeah,
confused.
but Dindo, speaking of politics and elections, how sustainable do you think is the stronger position of the Trump administration, given that this may have also just been for optics heading into the November elections into the
This is,
United States? They need to portray a stronger stance and try to
Bobby.
portray Joe Biden as weak.
Oo
If you
nga.
understand the supporters of President Trump, do you think they know where South China Sea is? So this is not.
sabagay.
This is, and if you will understand
They don't-
the defense and the state or the diplomatic circles of the U.S., both this is a bipartisan issue.
Okay.
This is a bipartisan. The only difference was that Obama or President Obama was more philosophical about this. They believe that China would be a good citizen of the world. But the past 4 years have told us that they will not. They will become more aggressive, even at the height of COVID. So even Biden, who is being placed in a position that he served the Obama administration, will now be forced to take a stronger stand. And some of the actions of the government now of the U.S. is actually based on decisions also of both houses of Congress. and
Right.
half of it is controlled by the Democrats. But again, we don't like this to be an issue of US and China. That's why we
Yeah.
said to internationalize it. We forgot that Australia, whose economy is based on China, is making a strong stand.
Yes.
You
Yeah.
would have heard of before the pandemic Taiwan, a smaller country than us, saying
Yeah. Na
we're
lumalaban,
not part
ano?
of China.
Yeah. Yeah.
And the campaign line of the president of Taiwan was, "We will never be part of China." Or Malaysia 2 years ago,
Yeah.
the coalition was
Right.
built around. So there is this growing support. So we get to be left behind because we seem to be, sad to say, do you know to whom we are identified with these past 4 years? We are
China.
part of the bloc of Laos, Cambodia, and Myanmar.
Mm.
I used to think we were part of the stronger bloc of Indonesia, Malaysia, Vietnam. So these things, Singapore. So it's quite frustrating. But again, these studies are things that
Yeah.
guide policymakers, and we just hope that this kind of studies enlighten our policymakers. But if not, enlighten all of us, that we know where the
Yeah.
general public is. And again, our secret to this is we like to do it with Social Weather Station, or a year ago with or 2 years ago with Pulse Asia, for the simple reason these are the same survey firms that says that the president is popular, so they cannot question the credibility of the surveys.
Yeah. Right.
So these are the same constituency of the president, telling him that,
Yeah.
sir, 7 out of 10 of your supporters might
Yeah.
like you to go a different path. And I'm hoping that this becomes really a national debate that will lead to a national discussion. It might be
Yes.
frustrating getting old with it. Imagine 4 years old already.
Yeah.
But you don't give up on this issue. It's about the territorial integrity and the maritime right of the Filipinos who won it in international community, who has the support of the international community, except our own government.
At saka mag-election na, no? Gamitin nyo yan. Yung data na yan. Come on.
So
Diba?
we'll see. We'll see nga. Diba?
Matagal-tagal pa yun.
Oy,
Maybe
bilis
not
na
in a
lang
live
yan.
conversation. I will
COVID
share some studies.
Pinag-uusapan na nga mga plano dyan, ano? Malapit na yan.
That's another episode. That's another episode.
Yeah,
Okay.
Actually, we have
Yes, sir.
data on that also. What are the
Oh,
weak spots of the government?
O, kaya nga, another episode
We
na
will
yan.
bring you in for another episode, sir.
We did it last. Actually, we did it at the start of the year. We're running it again because, but you'll be surprised. 2 of our surveys with Pulse Asia has been not pushing through. They're being stopped by police in terms of face-to-face surveys now are not allowed.
Actually, I was gonna ask very quickly, Dindo. I was gonna ask. I mean, especially for policy center and think tanks and people who use a lot of surveys. We were talking to Bahar Mangahas of SWS the other day. He was discussing also the limitations right now. A lot of mobile phone surveys and so on. I mean, what are our options right now? Na-addict na rin ng mga Pilipino sa mga survey. Are we flying blind right now in terms of the social weather stations? The social weather in the country. I mean, for somebody who uses a lot of surveys, I mean, how does it feel and what does it mean for what we understand about our country in these abnormal times?
Yeah, it's quite frustrating. That's why what we did for this quarter or the previous quarter was we really did 2 types of surveys. We commissioned Social Weather Station with their mobile surveys, but we also took a risk with Pulse Asia on a face-to-face. And Pulse Asia
you did?
Yeah, but they said they got the permit of the IATF. But after a while in the communities they were not allowed, so it was canceled. So we're hoping that maybe if we move into a modified GCQ, they can move around. Or maybe government does not like our survey firms asking questions. Remember
Huwag
last
natin
year,
baka dumagdag pa kayo sa numbers, okay? Baka mamaya, yun ang binabalita namin, Pulse Asia workers now positive. Naman.
that's why hopefully I can share that the moment when it comes out, if ever.
Yeah.
Okay.
Dapat
Okay.
lang.
Wait.
Okay. So,
Yes.
si Stratbase Managing Director Victor Andres Manhit. Sir, I always thought that your birth certificate said Dindo Manhit, but it's Victor Andres pala.
Dindo's the nickname.
Lion.
Lion.
Sige, sir. Thank you po for joining us tonight.
Thank you
Salamat
so
ulit.
much. Thank you.
Bye, sir.
Bye-bye.
Thank you, sir.
Bye.
Okay, we've gone well into overtime, so it's time to say goodbye. That will be all for this edition. So that's all for this special edition of the Chiefs. We hope what was discussed will keep the conversation going. I'm Edling Gaupo News.
I'm Ami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.